Worldlink got started about 22, 23 years ago and pretty much was built on a need. And the need was physicians, patients were asking for hormone therapy and they didn't know how to prescribe it. So they were calling the pharmacy and asking a lot of questions on how to prescribe hormone therapy, and we decided we should put on a course. So we sought out Neil Rousier, who was living in Palm Springs at the time, and we started teaching providers about hormone replacement therapy.
I'll tell you my very first day, and this goes back, I think, 21 years. I sat in the back of the room and there were about 20 of us. And Neil is presenting his material to us, and I'm talking to the fellow next to me, an OBGYN, and we thought he was nuts. But we decided to stick it out. Probably by the end of the first day, the crack was starting to happen in our paradigm. By the end of the second or third day, it was all over for us. And the world would never be seen the same way through my eyes after my few days with Neil.
Believe me, I've taken a lot of different courses from a lot of different lecturers. It's only Neil who has done it what I believe to be the appropriate way, which is more like a journal club or a review of the medical literature, as opposed to spouting some theories and hypotheses and saying this is how you should do it.
He invigorates us as an audience to help be involved in our learning process, and that makes it stick in my mind. So as I have questions come up with other providers, I'm able to answer those as well as possible.
The nice thing about Worldlink Medical is that we're transitioning it to an academy, and the passion really lies in preventive care. And hormone replacement therapy is a really huge part of that, because if people feel better, it's easier for them to get off the couch, it's easier for them to exercise, and ultimately their muscles, their tendons, they just feel and function better.
I see a lot of benefit for our patients with hormone therapy. Everything from their relationships are starting to decline, and all of a sudden they get on hormones and things get better. They don't feel themselves, they're agitated, they're tired, and after just a few short months of being on hormone therapy, their lives are back to the way that it was when they were in their 20s.
The benefits that they experienced were not just improvement in their blood sugar and their cholesterol and all the other measurements, but in terms of who they were. They felt and functioned 10 years younger. And since this is my belief and passion, I have to try as best I can to practice what I preach. I found the same thing.
So I think the thing that's really unique about this academy is that we're so community oriented. So we really want these doctors to feel like they have a place that they can go to where they feel like they are part of a community of like-minded providers that are really interested in thinking outside the box and changing patient care.
You know, the people at Worldlink are amazing. They're so fun to work with. It's just really great to have a team that helps me. You know, when I first started doing this, one of the real worries was, I'm out here all by myself, I'm all alone. But I gotta tell you what, the support here and the way that these people just really, really want to help you be successful, it takes away that fear of you going out into a specialty that really doesn't have the support that you might think that it would. You got it here, you're home here.
So for doctors that are potentially thinking about becoming a cash pay practice, Worldlink is a great place to be. Not only because you'll learn about the medicine, but also they understand what it takes to run a cash pay practice, because it's slightly unique. You need to be a little bit more patient-centric, you need to do a lot more marketing, you need to have a really good, well-rounded staff, because people have a choice about where they're going to go for their medicine, and you want them to choose you, and Worldlink understands that.